Okay. Friday, have you got audio soundbite number 1 standing by? You do. And this is me, folks. This sets up the latest Gruber and Obama audio. I'm going to take you back 4 years. March 5th of 2010. And this is me talking about health insurance reform and the plan to eliminate employer-based insurance.
Once a significant number of businesses have offloaded their health care benefits, and the government is now providing that insurance, how do you stop that? Okay, we're going to repeal this now. With the Democrats that will be out there saying, see, we told you, Republicans don't want you to have health care. Republicans want to take your health care away. Just like you senior citizens, Republicans want to take your Social Security away from you. The cost of doing business in the United States today, as you know, is very high. There's no economic growth. People are being laid off. People are not being hired. The growth is occurring in the public sector. In fact, for the first time, public sector employee average salaries are $7,000 a year higher than in the private sector. $67,000 versus $60 is the average, not the mean, the average. And this is a trend that has been ongoing for quite a while. So any business, you go out and talk to them. They hate the whole healthcare situation bugs them. They have to provide it. Employees expect it. They have to provide it to get quality people, but they hate it. The costs keep going up. The employees are never satisfied with all of what they're getting, even though the employees are paying no tax on it. It's a free benefit. Companies now have to have entire departments just to deal with that aspect of running their business, which has nothing to do with running the business. If you think a company will not choose an 8% off-the-top option payment to the government rather than 14 to 15% that is costing them to provide benefits for their employees, you got another thing coming. With as much pressure and stress on these people to stay open, all of this is by design.
This was my attempting to explain, and it's tough to take a minute and 45 bite. Half of that's irrelevant to what I was talking about. The point was that the government was going to offer businesses an opportunity to get out of providing health insurance for employees with a small one-time 8% off-the-top payment to the government. And that 8% payment to the government in lieu of providing health insurance, the government would take over then and provide it for people who lose their policies at work. And the point I was making there was that if you're a business and somebody comes along and says, hey, what you're now spending 15% on, I'm only going to charge you 8%, and you get to offload the whole problem of health insurance for your employees, you'll take it. Now, remember, this is 4 years ago, and the long-term objective here for Obamacare is to eliminate employer-provided or employer-based insurance and also eliminate, way down the road, the private sector free enterprise insurance industry. The objective long-term is to see to it that there's only one place to go for health insurance and for medical treatment. That's going to be everything run by the U.S. government. That's the long-term objective. And it's not just Obama's. It's every authoritarian type big government statist who's ever dreamed of running a country with an iron fist. The healthcare system is the thing that you try to get control of first because it's so important to people and it's something they can't deal without, and they'll do anything to get it, and you'll own them. You'll make them totally dependent, and they literally will do anything not to be frozen out of medical treatment and health insurance. So the long-term objective here is to take advantage of the fact the employers really, really increasingly don't like having to mess with all this, and the government's giving them an option to get out of it, still pay the government something, but maybe half of what it's costing them to insure their employees. Okay, that sets up the an old Obama video or audio and a new Gruber discovery. And we'll get to all that right after our bottom of the hour obscene profit timeout. Sit tight, coming right back. Out of it, you know they're going to take it. If they can get away with paying a fine for dropping it that's only half of what their cost is, and this was what the plan was. One of many plans in Obamacare to get as many choices for average people and their health insurance taken away from them. The employer benefit, I mean, it's part of a job now. Everybody expects to have health coverage. Everybody expects to have health insurance. It's just considered every bit as part of the job as salary is. And if you can take that away, you can panic people. You can take that away from them. You can legally allow their employers to offload that. They'll do it in a second. And then, if you're the government and you're oriented towards statism and authoritarianism, then you set yourself up, the government, as the first place and the easiest place people can go to replace the health insurance plan they had at work. And then you own them. Well, here's Obama. Let's go back to March 2007. This is a Service Employees International Union Healthcare Forum. Obama is a presidential candidate and senator at the time, and here is some of what he said.
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. I would hope that we set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out or 15 years out or 20 years out.
I don't think we are going to be able to eliminate employer coverage immediately. He's telling his union buddies it's going to take time. Be patient with me. I hope to have universal coverage by the end of my first term. He didn't. But even if we do, it's going to take a long time, maybe 15 or 20 years, because people aren't going to like this. He knows he's telling his union buddies behind closed doors comments here. Look, working together on this, we're going to eliminate employer coverage immediately. What that means is we're going to institute universal government-provided coverage. But he knows that people aren't going to go for it. He couldn't go out and get elected on this. This is what everybody's talking. He could not run for office and say, as part of his plan with Obamacare, to eliminate your health insurance at work. We want to eliminate that, and we want to be the ones that provide you your health insurance. Sayonara. He doesn't get elected. He doesn't get elected president. He doesn't get to do Obamacare. So he has to lie about it. And they rely on the stupidity of the American people to believe the lie. They rely on the stupidity of the American people to believe that they're all compassionate about this. They rely on the stupidity of them, the gullibility of the American people, to accept that all they care about is people, and they have the best intentions, when in fact what they're trying to do is turn this whole thing upside down so that they get total control over us. It isn't about health care. Health care is the mechanism to get there, and to expand government in such a way that it can't be undone by future presidents, future Congresses, or what have you. And so here is Obama being truthful, and this is 7 years ago, folks, being truthful with some very loyal donors and supporters, the SEIU. He's winking and he's nodding. Look, I know we want to get rid of employer coverage, but we can't do it immediately. 10, 15, maybe 20 years. Listen to this again. We played this all during the campaign 2008, hoping it would make an impression on people, hoping it would be heard, hoping it would awaken people out of the stupor in which they were looking at Obama as some messianic figure, blank canvas, make of him whatever they wanted to make of him. There was no good on the horizon even back then, but people didn't want to see it. Play soundbite number 2 again Friday, right?
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. I would hope that we set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out or 15 years out or 20 years out.
Okay, so here we are reminding everybody what Obama said 7 years ago. Tomorrow, in the drive-by media, the story will be our reaction to learning that Obama wanted to eliminate private sector insurance in 15 or 20 years. Well, employer provided, which is pretty much the same thing. I mean, the employer goes to private sector insurance companies to get plans, to get the coverage, to get the policies. I mean, the two go hand in hand here. If you eliminate employer provided, where you're going to go to become a member of a group to get your so-called group discount. You got to join some government exchange. So now Gruber, let's go forward 4 years. We're back to 2011, 4 years forward from Obama in 2007. This is March the 9th at the Pioneer Institute's 2011 Hewitt Lecture, The Budgetary Impact of Federal Health Care Reform. And here is the first of two sound bites we have from Gruber.
The Cadillac tax. Economists have called for 40 years to get rid of the regressive, inefficient, and expensive tax subsidy to employer-provided health insurance. It's a terrible policy. Turns out politically, it's really hard to get rid of. And the only way we could take it on was first by mislabeling it, calling it a tax on insurance plans rather than a tax on people. And we all know it's really a tax on people who hold those insurance plans.
Yeah, and of course, the only thing noteworthy here to the drive-by media is what my reaction to this is going to be. There's nothing to see here other than my reaction to it. But what do we have? We have once again the primary architect of Obamacare admitting they had to lie and mischaracterize a tax that was going to be levied on you, but they couldn't tell you that or it would never see the light of day. The Cadillac tax. Economists have called for 40 years to get rid of the regressive, inefficient, expensive tax subsidy to employer-provided health insurance. What is that? The employer-provided tax, the subsidy is that nobody pays a tax on that. I mentioned, I think it was either yesterday or Friday, the government considers all money to be owned by it. And anything you have is what government graciously determines to allow you to have after they have decided what of your activity they're going to tax. And anything that they claim is untaxed, they think you're getting a subsidy. You haven't earned anything. You're getting a subsidy. So if you have health insurance at work as a benefit and nobody's paying tax on that, then the government, Gruber's group, looks at that as though you are being subsidized by the government. The government gets its cut first. The government gets its take first no matter what, and then whatever you're left with is yours. But in the case of employer-provided health insurance, there's no tax applied. It's a free benefit. There's no imputed income. You don't have to report the value of it on your tax return. And these guys are coming along and saying, we can't do this anymore. We're going to have to start collecting tax on these benefits. And what Gruber is saying here, politically, this is going to be hard to do. People have gotten these free health care benefits for years. We can't just start taking that. So what do? Well, we mislabel it. We call it a tax on insurance plans rather than a tax on people, when we all know it's really a tax on people who hold those plans. So yet another instance, and another perhaps for Gruber, this is the most direct and maybe the clearest way he has admitted this fraud. I mean, this is an in-your-face, tantamount admission of the con game that was run. And it's still being run. Here's the next bite. Here is the second phase of Gruber's plan.
And the second one was to start it late, started in 2018. But by starting it late, we're able to tie the cap for the Cadillac tax to the CPI, not to medical inflation. What that means is a tax which starts by only taxing about the top 8% of health insurance plans essentially amounts over the next 20 years to basically getting rid of the exclusion for employer-provided health insurance. This was the only political way we were ever going to take on what is one of the worst public policies in America. And every economist should celebrate this. We took it on and got rid of it in the most expeditious way we possibly could have politically.
What he's talking about here is the fact that you get your health benefits free, that you don't pay any tax on it. And we've got to change that. And he found a way to do it now by fooling you into thinking you're not going to be paying the tax on it. And economists need to be celebrating this worldwide because this is a big deal. We're trying to figure this out. Get rid of the exclusion for employer-provided health insurance and ultimately eliminate it. So here it is, folks. I mean, this is all the stuff that's going on behind the scenes. All the lying, all the conning going on in order to get some modicum of public support. And actually, it never has had majority public support. Some of this was necessary to get Democrat votes. But it has been a deception from the moment of its conception. The whole thing is an intricately woven web of deceit that very little truth can be found inside. And they celebrate how they were able to run this con and fool you, and also celebrate what their long-term objective is, which is to eliminate one of the great options that you believe you've had all your life, and that is to get health coverage, health insurance via your job. I mean, all of this is despicable as it can be. It's deceitful, and I don't know how people in Washington, as they learn this, perhaps have it confirmed because they knew it already, can just sit by as though it's no big deal. Anyway, we must take a time out, my friends. These much more straight ahead, you can guess. Sit tight because it's coming right up. Notice how excited Gruber sounds in these bites. Notice how happy he is. He's excited at the cleverness that he obviously thinks he alone has come up with and used in fooling the American people. You can hear it in his voice. You can hear how excited he is. He's speaking so fast you can barely understand everything he's saying as he's talking to his economist buddies about how he's put the screws to everybody. Oh, yeah, we raised taxes on them, but we told them we were taxing the insurance companies, and they fell for it. Yes, sir. And we had to do that. Otherwise, there couldn't have been a way to get it done. Is this not great? Every economist ought to be celebrating the way we lied to the American man. It was so brilliant. I am so good. Oh, my God, does Obama know how lucky he is to have me? And we go to Brisbane, and Obama says, who? Gruber? I never heard of a guy. Some low-rent advisor. You know, people say what they want to say, but none of that's true. I just found out about this, and I'm mad about it. I'll get to the bottom of it. It's an amazing con.